What do you think about it now? I know that when Luke was just when I was just toying with the idea of getting him evaluated and stuff, I looked at everything, and ABA was one of them. And then there are different kinds of ABA. Some people are a little more aggressive with ABA, which I didn't like very much. And then there was like a different kind of ABA, it seemed.
Mhm.
And now I've been reading and listening to things that where people are like, well, maybe that's not quite the way to go, because it's not really in line with the whole um see what your child is doing and interact with them. It's actually trying to, it seems like it's trying to force them to change. And I think that I was never, that never really set well with me.
Yeah.
But what do you think?
You know, I've come a long ways when it comes to ABA, and I think what's happened is that the term ABA, which is an umbrella term for many different forms of teaching, um, has come to represent only one thing. And there are forms of what are called that are ABA supports interventions that are more developmentally focused. And especially for young children, we found that something like the Early Start Denver model, which is a form of ABA, a form of teaching, supports children learning social communication and interaction. And so there can be a lot of positives in some forms of ABA teaching. In the past, and where ABA started, was a form of ABA that is now called discrete trial teaching, or DTT or DTI, discrete trial intervention. And that is a highly structured program focused on teaching all kinds of skills across the spectrum of development, but is not always focused developmentally. So there may be teaching of certain skills before foundational skills are in place, if that makes sense. So it's not really focused on what typical development is. And most autistic individuals have some level of needing to walk through the levels of development. They're behind, right, in the development of certain skills. Some may have certain specific strengths, and others that they may be challenged with. Even skills of daily living that we need to learn, like how to dress yourself. And so some of these things I think can be taught in sort of an ABA fashion, but some of the discrete trial type teaching where we get young children sitting in a chair, responding to the adult. And I think, Jason, this is what you're speaking to, does not accept them as the human being that has wants and needs and interests. And we just need to help them unlock those and how to communicate them. That's a
Yeah.
very different way, right? And I think what I've heard from many, from reports from individuals now that are adults that had gone through that form of ABA, they felt like it was basically kind of infantilizing to them. They actually knew and understood a lot more. It was more about how to unlock that, not about teaching them the skill. So here we are teaching skills that they may already know how to do. The motivation's not there. There's some other reason why they can't show the skill, right? And so I know that many ABA professionals are trained and can be very helpful sometimes when children are having specific behaviors that could be hurting others or hurting themselves, and ways to help walk through that. I think the key in ABA, if it is a system issues, and this is up to, the unfortunate piece is that this is often starting in childhood. And that's where a lot of the self-advocates have problems, is that these are children that, one, are already struggling to communicate, and they aren't able to tell you, is this something I want for me, for my life? They're not able to tell you that. And so, I think this is just an evolving situation I think that if there are ABA professionals, that we all work together as a team, because exactly like what you said, Jason, the things that I was teaching you in the Hannah More Than Words program may have gone against what they may have been teaching in a different setting with ABA principles. Is that
Yeah.
make sense?
Yeah, it makes total sense. It's very similar to showing a child. I don't want to sound negative, but like showing a like I feel like a child that receives love and trust and safety will prosper more than one that is fearful and frustrated. So depending on where your child is in the spectrum, I feel like your job is to make them feel good as and happy with what they're doing. And so maybe if they're sure someday you'd like them to use a fork, but if it causes them if you're doing some kind of thing like ABA, actually before I go there, could you explain what ABA is to someone that doesn't know what it is?
Yeah. I was going to ask you that because people watching might
Yeah.
have no
May
idea
not know
what that is.
Yeah.
So applied behavioral analysis, ABA, is kind of an umbrella term for interventions that have been used in different populations, not only for autistics, but for even for individuals who may have intellectual disability, to teach them discrete skills. So that could be learning how to brush your teeth, learning how to wash your hands. It could be learning how to sort shapes. It could be learning how to use a word to communicate. And it goes across all kinds of life skills, both academic and life skills. And so it's a way of using repetition, pretty significant repetition, as well as reinforcements for appropriate responses. So most ABA is focused on the response. What is the outcome? I want them to do X. I'm going to show them how to do it, and then I'm going to expect them to do it, and then I'm going to reinforce that behavior. So pretty much all of the ABA is looking at the discrete skills that you're teaching and the behaviors and the outcomes, right, in the child. That's what ABA is. How we go about using ABA principles may look different depending on the type of or form of applied behavioral analysis that's being used.
Yes.
Is that clear as mud?
Yeah, that's pretty clear.
Okay.
And so what I was going to say was like Luke can use a fork. He's perfectly good at it. If I'm standing next to him. And if I put my hand on his left left hand, he'll eat with a fork like no problem. As soon as I walk about 2 feet away, he's looking right at me using his hand again. Like I don't really judge him. I think that's actually easier to use your hands, but I don't reprimand him for it. I just go back over. Reprimand. You can't reprimand that kid. It's impossible. He's just sweetie.
Oh my gosh.
You just go over and I just put my hand back on his hand, you know, and all I have to do is touch it, and he'll keep going. But with ABA, should be the idea would be to actually make it somewhat annoying to them, or not. It's the worst way to put it. Like, you're doing something wrong. Like, give them the feeling that they're doing something wrong, right? Is that the idea? With like, how would you teach fork instead of hand with ABA?
Right. So I don't think the intent, we have to take out, and this is what I think is the issue, the intent of what the person is doing that's implementing ABA versus what the procedures are. I don't think the intent is negative. But in the history of ABA, there were negatives. So when Skinner developed this type of intervention, aversives were used. Sometimes shock, things that we would never think, were anywhere close to appropriate. Or averting your eye gaze from someone when they do it the wrong way, to send a message that was wrong. So, but we've shifted a long way from that, and that is not how things are done with ABA any longer. But with ABA, what you might see is some kind of directive: use your fork, or let's eat. And if they're not using the fork, they may put their hand around the fork, and they may take the fork and move it to their mouth and put it down and say, good job, and then reinforce them. You may
Okay.
see something like that.
Yeah.
It may not be that structured, but that's kind of like a discrete trial. That's a trial. And then there's data taken. And then we do it again until we start to pull away all of those supports that we have in hopes that they would do it on their own.
Okay. Yeah. You slowly pull away the supports, like you don't just abandon, because
Right.
then, right. Yeah. Like maybe like if you put your hand, if you're doing hand over hand with them, you might just grab their elbow.
Exactly.
Right? Yeah.
Exactly.
Yeah. Okay. Yeah. Oh God, all that's coming back to me now.
Yeah. And in some ways, what you're doing for Luke by touching his hand is giving him a little bit of a prompt. Oh, it's time to use your fork.
Yeah.
I mean, you are kind of doing that, giving him a support.
Oh yeah, totally. Well, he knows too, because when he's eating with his hand, he looks at me. He's watching me the whole time. Like, it's like a mischievous thing almost. It's really cute.
And how old is he now?
He turned 5 in
5.
April.
Well, he is 5. And that's the thing we have to remember too. And I tell families all the time.
That's so true.
Some of the things that autistic kids do are what every other kid does.
Yeah.
So there's also, I feel like sometimes we have expectations that are inappropriate. Especially when I see a 2-year-old, I'm like, you have to remember they're 2.
That's what you said to me when he was 3. You said, you have to remember he's also 3. And I was like, right. Like, he's not writing emails yet.
No, he's a 3-year-old. And 3-year-olds do things and that they're not supposed to, and look at you like, did you see me? Yeah. I mean, a lot of these are fairly typical behaviors of children in their age range. So
yeah, that was great when you said that to me. It really it set me on a right path, because I was like just giving him, had expectations, or I was just designing like a path for someone that wasn't 3.
Right.
I was just like, wait a minute, and I was like, oh yeah, he's 3. Maybe he doesn't want to go to bed.
That's pretty normal.
Yeah. Wow, that's yeah.
Maybe he likes eating with your hand on his hand.
Yeah.
Maybe
it could be.
Or maybe he just Or maybe he's just like, wait a minute, if I know that if I do this, Dad is going to do this.
Right.
And then he's just like,
he definitely
let me try it again. Maybe he's doing the same thing you're doing. You're like, okay, when I put my hand on his hand, then he's going to use his fork. And he's like, when I
eat with my
Dad
hand.
goes away. Yes.
Maybe he's just like, I really like eating with you next to me. And it only happens when, when I eat with my hand.
He's training you, Jason.
He totally is. He's training me in a lot of ways, and I have to remember it often, because I like I said, mix things up. Yeah, that kid never knows what's going to happen.
You're preparing him for life well.
That's right.
We don't know what's going to happen, especially today.
Oh yeah.